Hello, my name is Maria Grosvenor. I'm the Systemic Anti-Cancer Therapy Nurse, formerly known as the Chemotherapy Nurse. I'm going to talk to you today about long-term side effects of these treatments and a little bit on how to manage them. What you can do for yourself is read the literature when it's given to you by one of the healthcare professionals. Ask questions. Any question, no question is stupid, so ask as many questions as you wish to, and report side effects. That is extremely important because side effects not being reported may lead to these long-term conditions and make things worse. Please report if you do get any side effects. Side effects can affect different systems or organs of the body, and I will go through these one by one. So side effects of the heart. These are rare. However, if you have been a patient who's had non-Hodgkin's lymphoma at a young age, then the radiotherapy you received may cause a long-term effect of your heart. Being over 65 can also be a risk factor. Having high doses of chemotherapy and having certain chemotherapy drugs that we know cause higher risks to the heart. If you experience any of the following, then it's important that you seek advice from your GP. If you feel dizzy or lightheaded, and especially from going from a sitting to a standing position, if you develop shortness of breath, if you have swelling in your hands or feet, or any sudden onset of chest pain, please seek advice. Some treatments can cause high blood pressure. You can help lower your blood pressure by losing weight, eating a diet that is reduced in salt, being as active as you can, and taking medications that are given to you for this condition, and monitor your blood pressure if you've been advised to do so by a healthcare professional. Another organ is the lungs. Chemotherapy and radiotherapy to the chest can increase the risk of damage to your lungs. They can include the way in which your lungs work. They can cause thickening of the lining of the lungs, inflammation of the lungs, or difficulty breathing. If you experience any different signs of a breathing abnormality, please seek help from your GP. You may be given hormone therapy as part of your treatment. Some treatments may trigger menopausal symptoms for both men and women. These include hot flushes, lack of a sexual desire, and mood changes. Please seek advice from your GP, as you may be required to take medication, or practical tips can be given by your healthcare professional. Some treatments can cause osteoporosis, that is thinning of the bones, or problems with the joints or tissues. You can help reduce these risks by avoiding tobacco products, eating foods rich in calcium and vitamin D, becoming physically active as much as you can, and limiting the amount of alcohol that you drink. Long-term effects can also sometimes have an effect on your brain, your spinal cord, or your nerves. Most include a degree of hearing loss. Please seek help if you have noticed that, and nerve damage, especially tingling in the fingers and toes, or a degree of numbness. You may find that you may trip easily, or not feel things, or not be able to do up buttons. Please seek advice if this is the case. You may also have concentration issues, memory loss, short term, or just not being able to remember the words that you want to use. This is sometimes known as chemo brain and is much more prevalent during treatment, but you may find that it takes you a few months to get back to what you were normally like. You may have problems with tooth enamel, so please have regular checks with your dentist. Visual problems are normally a problem during treatment, but sometimes people find that they continue on, and I suggest you get an eye test. You may get digestive issues. This is normally in the form of indigestion, and it may be that you have to take remedies that you can buy over the counter, or we can provide something for you if this becomes a regular problem. Emotional difficulties, the fact that you've had a cancer diagnosis, that you've gone through treatment, that your body may have changed as a result of treatment, all need support. And normally you can get this from family or friends, but you can ring the cancer support workers who will be able to help you with extra help and advice if you should need it. Unfortunately, in some of the longer term treatments that normally include chemotherapy and radiotherapy, you are at a slight more risk of developing a secondary cancer. Secondary cancers are a known problem for people that receive long-term chemotherapy or radiotherapy or one of those treatments. They are rare, but they are something that we do look out for people that have had treatment in the past. And fatigue. Fatigue is a real problem during treatment and can go on for months and sometimes years. And people need to understand that this can be a side effect from treatment and what they can do to support you. You can talk to your work colleagues and your friends who should help you with this. Please take regular exercise, drink plenty, and rest at different times of the day. Questions you can ask your health professionals at the end of your treatment span is, am I at risk for specific late effects? Is there anything I can do to prevent long-term effects? What other specialists need to be involved in my care? What signs or symptoms should I watch out for? And who will be my primary contact point at the end of my treatment? And how will I be monitored and for how long? Although I have gone through all of these side effects with you, please note that most patients do not have long-term effects, but be aware that you can contact your key worker, your cancer support worker, or your GP if you need any more help and advice.